The bystander effect in the Kitty Genovese case. Introduction. The case of Kitty Genovese has remained in the public consciousness for over half a century, and its impact can still be felt in modern-day discussions on bystander intervention. The case has been studied in numerous academic and psychological studies, and it has been referenced in popular culture as well. Despite the case's tragic nature, it has had a positive impact in raising awareness about the importance of bystander intervention and the legal questions that arise from it. By examining the legal theories of the American bystander rule and the Good Samaritan doctrine, it is possible to gain a better understanding of the duty that bystanders may owe in emergencies. This paper will explore these theories concerning the case of Kitty Genovese, providing insights into the legal and ethical questions that arise from omissions in emergencies. Omissions, legal duty owed to Kitty Genovese. Whether bystanders owed Kitty Genovese a legal duty has been heavily debated. In the case of Genovese, multiple bystanders saw or heard her being attacked but did not intervene. Some argued that the residents had a legal duty to intervene, while others argued that the neighborly relationship does not give rise to a duty. Under the American bystander rule, bystanders are generally not obligated to intervene in an emergency, as there is no legal duty to act. This distinction is important because, as Leung et al. Noted, the Good Samaritan doctrine imposes a legal duty on individuals to intervene when possible. In contrast, the American bystander rule only applies when there is no special relationship between the parties involved. The case of Kitty Genovese presents a unique situation because multiple bystanders could have intervened. The Good Samaritan doctrine suggests that these bystanders did have a legal duty to intervene and prevent harm. The American bystander rule argues that the bystanders had no legal duty to act as they had no special relationship with Genovese. Legal theories, American bystander rule and Good Samaritan doctrine. The American bystander rule is often cited in legal cases where bystanders fail to act, and its application has been widely debated. In the case of Murphy et al., bystanders were sued for failing to perform CPR on a patient, arguing that they had a duty to act under the Good Samaritan doctrine. In contrast, the case of Leung et al. Examined the effect of Good Samaritan laws on first aid learners in Hong Kong, suggesting that such laws could increase bystander intervention rates. In addition, West explains that Good Samaritan laws have been implemented in several states in the U.S. to encourage bystander intervention in medical emergencies. Despite these differing views, the American bystander rule remains a crucial legal theory in determining whether bystanders have a legal duty to act in emergencies. However, some scholars argue that this rule is overly permissive and should be modified to include situations where the bystander can intervene and prevent harm. The American bystander rule is significant in determining the legal duty of bystanders in emergencies. It is crucial to consider the potential consequences of failing to act and the growing recognition of the moral obligation to help those in need through the Good Samaritan doctrine and Good Samaritan laws. A legal framework that reflects this obligation is necessary. Analysis. The case of Kitty Genovese is a complex example of legal omissions and the application of legal theories to real-life situations. Even though multiple bystanders saw or heard Genovese being attacked, none intervened to help her. Some legal scholars argue that under the American bystander rule, the bystanders did not have a legal duty to act, as there was no special relationship between them and Genovese. They were not police officers, healthcare providers, or emergency responders, nor did they have any contractual or familial relationship with Genovese that would impose a legal duty to act. However, others argue that the Good Samaritan doctrine applies in this case, as the bystanders were in a position to intervene and potentially save Genovese's life. The fact that they were neighbors, while not necessarily creating a legal duty to act, may have imposed a moral duty on them to help. Ultimately, the debate over whether the bystanders owed Genovese a legal duty highlights the complexity of legal omissions and the different legal theories that apply in different situations. Conclusion. In conclusion, the case of Kitty Genovese Winston Moseley raises essential questions about legal omissions and the duty of bystanders to intervene in emergencies. While bystanders owe no clear legal duty in situations like this, the Good Samaritan doctrine and the American bystander rule provide some guidance. The Good Samaritan doctrine imposes a legal duty on individuals to intervene, while the American bystander rule generally does not. It is important to remember that while there may not be a legal duty to intervene, there is a moral obligation to help those in need. Ultimately, it is up to each individual to determine the level of responsibility they feel towards their fellow community members and take action accordingly. Therefore, it is crucial to promote public education and awareness of the importance of intervening in emergencies to reduce the number of bystander omissions in future situations.